Running a medical healthcare clinic isn't just about providing just fantastic health care or great patient care. It is about so many more things. And oftentimes you're got into this business because you're an amazing practitioner and you really care about your patients. But being a business owner doesn't always come as first nature. And that's why I'm going to walk you through some things that you can do as a medical practice business owner and a mental health care business owner, and will help you transform your practice and do a lot better. Because in addition to just running a great practice, you have to manage your finances effectively. And let's be honest for a second, balancing those two things, being a great practitioner and managing the finances of the business, can be tricky at times, can be a little hard. And you want to ensure, which I'm sure you're aware of, you want to ensure that patient care takes the priority at all times. And I think you probably already do a great job of that. If you're watching this video, I'm sure you do a great job of it. But I'm going to walk you through some really simple, basic things that you can be doing as a mental health care practice owner to be financially healthy, which will allow you to buy back your time, have freedom, and actually have the practice that you want. First, we're going to talk about how to understand cost management in your mental health care practice or your mental health care clinic. What is exactly cost management? At its core, cost management is about controlling how the money is spent in your practice. It's not just about cash out or cash in, it's about how the money is spent. And in a mental health care clinic or practice, it's about finding ways to keep expenses as low as possible while also ensuring you maximize high quality patient care and finding ways to improve the patient care through the use of technology and the use of labor less processes. That's how you save money. And again, it's not just about saving money, but it's about strategically improving patient care without spending an arm and a leg to do it. And why is cost management so important? Well, when it's done right, cost management helps your mental health care practice in three very distinctive ways. First, financial stability. And without financial stability, your practice has this cash flow pressure on it, and you feel that pressure as the owner. And it is hard to ever get out from underneath that 300-pound gorilla. Number two, you have what's called better resource allocation. You can put better people with the right patients. You can spend more time with the right patients that you want to. And more importantly, you can spend more time with things that you want to work on, that you want to do, have freedom in your life. And then number three, and which is probably my favorite and why you got into this business to begin with, cost management allows you to have improved patient outcomes. So in the end, your patients benefit most of all, and it allows you to be the most successful mental health care practice owner that you've ever wanted to be. So with that, I'm going to tell you about the four key principles of cost management in a mental health care practice. The four keys or the four key principles are: number one, I want you to take a holistic approach. Number two is stay patient centered. You know that already, but stay patient centered. Number three, be data driven. And then number four, collaborate and communicate. So let me explain that. First one, take a holistic approach, is you need to look at all aspects of your clinic, from administrative services to communication functions to even support services. Every aspect of it, I want you to look at and see what are the steps that can be used from a technology perspective or a labor-free perspective or hands-off and still create high patient care, right? That's the holistic approach. I want to look at everything from the beginning to end. Number two, keep the principle of stay patient-centered. Patient care has to be at the center of what you do. All things being equal, patient care is what separates yourself from any other practice out there. So always keep that at the top of everything you do, from the words that you send to the paperwork that you send to the experience they feel when they interact with your staff. Number three is let the data tell you the truth. If you implement a new technology that has them do paperwork via a text, or you've created a video series that helps them learn about your new ketamine servicing or whatever it is, Let the data tell you the truth, and the data will tell you what actually works. And if your patients are responding to the work that you're producing. And then number four is collaborate and communicate. Use your team around you to come up with these solutions. The more your team comes up with these with you, they will have buy in and they will help implement these solutions. Now, these four principles are just simple things that you can holistically look at and use to help you change your practice, be more effective with cost management, and be financially healthy as a mental health care practice owner.